Did you know that between 2.5% and 5% of the cats in North America are impacted by feline immunodeficiency virus? This is a virus that's similar to HIV in humans. Today, we'll break down everything you need to know about FIV, how it's diagnosed, how it's spread, and more importantly, what you should expect if your cat's been diagnosed with FIV. This diagnosis can sound scary, but with the right knowledge, FIV does not have to be overwhelming. I'm Dr. M. Welcome to VMC. Join me. You'll learn something today. FIV is part of the retrovirus family, which is the same virus family that HIV in humans is found in. These do both attack the immune system of the species that they impact, and there is no cure for either of them. In humans, of course, we've had wonderful advancements of treatments and management. Unfortunately, we don't quite have that same advancement for our cats yet. FIV was initially recognized in the 1980s, and it is something that's present worldwide. Now, it is important to know that FIV is species specific. So a cat with FIV cannot infect humans or dogs with feline immunodeficiency virus. This virus does weaken the immune system of the animal that has it, and this will make them more susceptible to infections and some illnesses over time. So how do cats get FIV in the first place? Well, infected cats shed this virus primarily in their saliva. And so the most common way that FIV is spread from one cat to another is through a bite. So the one cat that is shedding the virus in their saliva will bite another cat, and that will result in inoculation of FIV into that new cat. This is why FIV is more commonly seen in cats who spend time outdoors, especially if that cat is not neutered and is male. It's a lot less common, but it's possible at times for FIV to be transmitted from an infected mother to the kittens. We aren't exactly sure when these kittens tend to get infected. It may be across the placenta when the kittens are still in utero, or it may be as they're being born. It may also possibly be when the kittens are nursing from their mother. Now, not all kittens born to infected mothers will develop FIV. Research indicates it's roughly a quarter of them. We also need to know that there are 3 stages to FIV. We have the acute phase, the latent phase, and then finally the progressive phase. So the acute phase occurs when the animal first is given FIV. For the first 1 to 3 months, roughly, after they've been infected, the virus is being carried through the lymph nodes to the body of that cat. This will result in some lymph node enlargement. We might notice things like a low-grade fever or some upper respiratory symptoms, a little bit of a decrease in energy, that sort of a thing, but often people miss that this acute phase has even occurred in their cat. Following the acute phase, the cat will go into the asymptomatic phase. Now, the good news is that during this time, these cats don't have any symptoms, and the asymptomatic phase can last for months or even many years. The virus will be replicating very slowly within the cat's immune system during this time, however. So sometimes we might see some slight changes in blood work because of that. And there are also going to be some cats who stay in this asymptomatic phase forever. And then unfortunately, there are others who progress to the 3rd stage of FIV. For cats that do progress, they will over time become more and more immunocompromised. It's important that we notice that the symptoms and problems caused by FIV are often not due to the virus itself. It's most often because this makes the cat prone to developing infections or other diseases that cause the symptoms for the cat. We'll often see chronic or recurring skin infections, eye infections, upper respiratory infections. It's also very common to see painful dental issues or red and inflamed gums. We call this stomatitis. These cats are also more likely to develop some cancers and some immune-mediated blood disorders. We also may see things like appetite changes, weight loss, and rarely we'll see neurological symptoms that may include things like seizures. Do keep in mind that there are so many different health issues that can cause these symptoms, but it should be something that your veterinarian checks for. We do have some wonderful tests to test cats for FIV. Most commonly, we will use a SNAP test that will look for antibodies for FELV and FIV at the same time. We should be testing all outdoor cats regularly, or if you're bringing a new cat into your household, or if you have a cat that's become sick. Now, there are a couple of situations where we might have a cat who does have FIV, but that doesn't test positive. This is because our tests do check for antibodies to the FIV. It will take 2 to 6 months after infection for a cat to develop enough antibodies for a test to regularly pick them up. There may also be very rare situations where a cat is so immunocompromised that they're no longer producing enough antibodies. This situation is a lot less common though. If your cat does test negative but your veterinarian is still suspicious of something like FIV, we will often recheck them after 2 to 6 months. It is also possible that we will sometimes get a false positive. So if your cat does test positive, we will generally confirm this positive by sending a blood sample out to a separate lab. They have slightly different testing and they can confirm a positive FIV result for us. Now, there are 2 more common scenarios where we might see positive antibodies, but it may not mean your cat actually is positive for FIV. And the most common is when we're testing young cats that have antibodies from an infected mother. But as I mentioned before, not all of those kittens will end up having FIV themselves. So if we test a young kitten and it comes back positive, we should retest them at the very least once more when they're around 6 months of age. Some people advocate for testing them every 60 days until they test negative or are 6 months of age. The second situation that can give us a false positive is if the cat has previously been vaccinated for FIV and has developed antibodies because of that. We did used to have a vaccine in North America. It's no longer available, so knowing the vaccine history for your cat is necessary. There may also be other countries that still do vaccinate cats for FIV, so knowing if your country does or does not is an important piece of information. I do also want to stress here that a cat being diagnosed as FIV positive does not automatically mean that they're doomed. A lot of these cats live wonderful, long, healthy lives, even with an FIV positive status. I do want to be upfront with you though, there is no cure for FIV, but there are some things we can do to give our cats the best lives possible when they are FIV positive. Here's some essential tips you need to know. If your cat is FIV positive, at the slightest sign of illness or infection, it is absolutely crucial you see your veterinarian right away. And any infections may need to be treated with longer or more aggressive courses of antibiotics than we might otherwise use. We will also want to be more aggressive with parasite prevention than we would for other cats. This is because anything that stresses your cat or impacts their health may have more serious consequences for an FIV positive cat. And we also aren't sure if blood-sucking parasites like fleas, we don't know for sure if they can transmit FIV or not. This is something we need research in. For a cat that is otherwise healthy that we end up finding FIV incidentally on screening tests, the prognosis for these cats is generally great, and we will focus on reducing the risk of secondary infections as well as making sure that we don't spread FIV to any other cats. So we will need to spay or neuter these cats if they haven't been, just to reduce any risks of passing FIV on to kittens, also to reduce risks of fighting or roaming. We would also want to use catios to keep these cats enclosed and not let them spend time unsupervised outside where they might get into a fight. Reduction in stress is another very important thing for managing a cat with FIV because stress will further compromise the immune system, and these cats need as much help as they can get with keeping their immune system as functional as possible for as long as possible. It is also incredibly important to feed these cats properly researched, properly formulated diets that meet WSABA guidelines. Diets or treats that are freeze-dried or raw or things like uncooked eggs are going to be particularly risky to these cats because the likelihood of them developing infections like Salmonella or E. coli or TB is going to be much higher for these cats with their compromised immune system. We also need to have FIV positive cats brought to see their veterinarian at least once every 6 months, and we should do a physical exam and a blood work panel during these visits to track for any changes in how they're doing and if they're having any infections or decompensating in any way. Subtle weight loss is often one of the first symptoms that we'll catch if they are having a worsening of their disease. But with these measures, a lot of my FIV positive patients end up having a wonderful, healthy, happy, and long life with their people. Now, I'm sure you're wondering about things like antiviral treatments because we have these for the humans. Research that we have has shown limited success for cats. Sometimes we will use an antiviral called AZT. The brand name is Retrovir, and it's commonly used for people who have HIV. There is a decent risk of serious side effects, things like the bone marrow not producing enough red blood cells. So for a cat that's mildly or asymptomatic for FIV, we will not use it. But in some situations where they're seriously ill or have neurological symptoms, it might be brought up by your veterinarian. Interferons are another group of medication. They are naturally produced compounds that have antiviral effects and that can modify immune responses. There is a recombinant feline interferon. It's available only in some countries, so you'll need to check with your veterinarian depending on where you are. And the research isn't all that promising, but it might be something that's an option for your cat. But overall, as I mentioned, the focus really is on preventing infection and other diseases and doing regular monitoring to support the cat as best as we can. Now, there are also a number of very common myths and misconceptions about FIV that I hear about, so let's tackle a few. First myth that I'll hear is that FIV is a death sentence. This just isn't true. Research shows us that 5 years after diagnosis, 18% of cats will end up having died, and the ones that do have the worst prognosis are the ones that are quite sick when they're diagnosed. If your cat is healthy when they're diagnosed, the likelihood of them living many years still is very high. Second myth, FIV cats cannot live with any other cats, period. And I'm going to push back on this myth as well. Since FIV is primarily transmitted through bite wounds, it is possible for an FIV positive cat to live with other cats if, this is a significant if it is a peaceful and harmonious household. If the cats like each other, if they do not find the presence of each other stressful, then it's absolutely possible to keep an FIV positive cat with an FIV negative cat. However, if there is any chance of fighting, or if the presence of multiple cats is causing stress to the FIV positive cat, then it will be necessary to rehome the FIV positive cat so that they can find a household where they are the only cat. This is a case-by-case situation though, and you should discuss it with your veterinarian. If you do have a mixed household, it would be advised as an extra measure of caution to feed them out of separate bowls, because we do know that FIV is so present in the saliva of infected cats. So after every meal, you should thoroughly, carefully clean the bowls. This is because we wouldn't want the off chance of one cat who is not FIV positive to have a cut or some bleeding or something in their mouth, and that they go and have contact with FIV positive saliva from another cat's dish. There is going to always be some risk, so consider carefully. Another myth is that FIV is highly contagious, and this just isn't true. It is not spread by things like casual grooming or cuddling. If you have followed VMC for a while, you will know how much I harp about prevention wherever possible. There are no vaccines in North America for FIV at this time, so what you need to be doing is limiting your cat's risk of contracting FIV. This is by using things like catios or walking your cat on a leash and harness for their outdoor time. Second, you also need to be very diligent about testing every new cat that joins your household. It is also important to know that FIV doesn't generally live in the environment for more than a few hours. So if you know that you're bringing a FIV negative cat into a place that has had an FIV positive cat, simply a thorough cleaning with a diluted bleach should be more than sufficient to get rid of any virus that might be in the environment. You can also vacuum and mop the floors and make sure that you're cleaning things like bowls. Really, the spread of FIV through the environment is quite low. So there you have it. FIV is not something to fear fear, but it is something that you should be aware of. And with a little extra care, so many FIV positive cats live wonderful, happy, long, healthy lives. If you found this information and video helpful, please give it a thumbs up and share it with someone you know. I do put out a new video most Fridays, and if you have a topic you want me to cover in the future, do not hesitate to comment it down below. I would love to hear from you. I hope that you and your pets stay healthy and happy until I see you next time, and YouTube thinks you'll like this video. All right, bye.